Thank you, Dr. Paul. I'd next like to introduce Dr. Dianne Ward, who will provide an overview of what is known about effective interventions for children 2 to 5 years of age in the early care and education setting. Dr. Ward is a professor of nutrition at the University of North Carolina's Gillings School of Global Public Health. Her research is focused on the prevention of childhood obesity through home, school, and community interventions that promote healthy eating and regular physical activity in children and in families. Welcome, Dr. Ward.
Thank you, Jennifer. It's really nice to be here. What a great panel this is that I can be a part of. My job is to zero in on the settings where many young children are enrolled, and that is in the child care setting. And my goal is to identify what we know as successes, what are some of the gaps, and then what are our opportunities in this setting. Okay, well, let's see if I can't mess that up. Okay, all right. There are a number of children, more than 60% of all children under 5 are enrolled in some sort of out-of-home setting. The way we now refer to this is early care and education, so I'll be talking about ECE. And this care arrangements can be in the form of child care centers, family child care homes, Head Starts, a unique kind of center-based care, and even a pre-K programs, which are ECE settings that are usually associated with schools. There's also unlicensed or license-exempt care that might be in the form of neighbors, relatives, or friends. These are usually below the radar, and there's very little research in this area, so I'm not going to talk about that today. The ECE area has been identified as a missed opportunity, and so I think it's important, and I appreciate the opportunity to have this included in this session today. Also, when I'm going to talk about what we do know as successes or opportunities, it may be for impacting health outcome, but it may also include the outcomes of healthy diet and regular physical activity. Recently, a paper was written led by Meredith Reynolds and a number of others focusing on the spectrum of opportunities in the early care and education setting. And I thought it was really interesting. It's a very useful and effective description of where are some of the areas that we might be able to intervene. And it sort of reminded me of another model that we're familiar with, which is the social ecologic model, that there are a number of levels of influence and that we might be able to intervene on different ones of those. So I'm going to start by talking about the most upstream area, and that's in the area of public policy. And so there are a lot of ways that we can impact the quality of the experience that the young child receives in the ECE setting. We can do it through licensure and setting appropriate standards at the level of a licensed facility. We can also do it in another way, which I sort of refer to as a carrot rather than a stick, because it's the quality rating and improvement systems where people can participate. These facilities can improve their quality and have a public information about whether they're rated higher than other facilities. And if we use nutrition and physical activity standards, then we can elevate the experience that children receive. We can also leverage funding that comes to block grant funding that comes from the federal government to states, and we can tie funding to higher quality enhanced standards. And also, if they're in the individual states where their learning standards are described for early care settings, we could, if we include specific nutrition and physical activity standards, this is another way that we might be able to affect what the children experience. But a lot of work is now done at the more of the organizational level, at the level of the facility itself. And there are a lot of things that we know that do work. We know that we can affect change in the quality of the nutrition and physical activity environments in these facilities. We can do it. We can improve the foods and beverages served, the amount of physical activity that's offered. We can control the amount of screen time. And we can do this in a way, sort of as Dr. Paul was talking about quality improvements. These are improvements that happen regularly, not trying to get improvements all at one time, but on a regular basis. We also know that if facilities aspire to and achieve external certifications or ratings, such as an Eckers rating or an NAEYC rating, that those facilities lift their standards, and so the experiences that the children receive in nutrition and physical activity are also elevated. There are a number of existing curricula that focus on nutrition and or physical activity that can be used by child care or early care facilities. Now, the data in this, coming from the use of curricula, is a little weaker, but in the collective, it sort of comes together in a strong way. Many of the studies that have been tested curricula are usually maybe quasi-experimental or have a lower level of design, but I think collectively they show that there's an important impact by their use. We also, I think one of the areas where there's a lot of work done is in providing structured physical activity lessons. And it's pretty clear that if structured lessons are provided by individuals with training or expertise, the result is improved amounts of physical activity and or improved fundamental motor skills. There's greater evidence about improvements in the fundamental motor skills than in the physical activity area, but we know these two are linked. We also know that training and technical assistance that is provided to early care and education teachers improves, improves their ability to actually provide these physical activity lessons. We don't know so much about this in terms of nutrition and nutrition education, however. Another area that is that we see promise in is in improving the quality of the outdoor environments associated with an ECE facility. There are certain characteristics that seem to be more related to better physical activity. We know that the availability of portable play equipment to engage the children in activity is associated with more activity, and there is some evidence that indicates that maybe how many children are in the outdoor area at one time may be related to how much activity the children are receiving. There's some gaps that need to be explored. There's some new research out recently about the role of vigorous physical activity and its impact on the body composition of preschool-age children, and so there needs to be exploration in vigorous physical activity. The whole area of sedentary time and whether we should be reducing the amount of time children spend in a sedentary position in early care settings, maybe removing some chairs from existing tables or having regular breaks from sitting. Energizers, which has been successful in elementary school children to get more activity as well as provide a better focus during lessons, needs to be explored, and certainly improving the amount of overall activity that children get in the curricular time of circle time, center time, and in transitions from one activity to another. Continuing with this organizational level, more gaps in the area of nutrition. There's been a little work about offering fruit or vegetable prior to the main offering as a way of getting more fruit and vegetable intake. There's some information about food tasting and cooking, gardens, whether policies about food brought from home or celebration foods, and the whole area of family-style dining. Most nutrition experts suggest that this is the most appropriate way to develop an independent eater, but the data on the impact of family-style dining has not been explored as much as it should be. Moving to the interpersonal level, down a little closer to the level of the child. Again, this is both promise and gap. There is some indication that how the ECE professional interacts with the children around food is directly associated with how the child eats and what they consume. But then there's other areas that we have not tested and explored. Specifically, this whole area of responsive feeding, we heard this in the earlier session this morning, and these are not parents, but they are people, individuals who actually are serving in that role during the ECE experience. So there's work that needs to be done in this area. There's less known about the role of the ECE professional as she interacts with the child around physical activity. There's some indication that joining in and play and being a role model is associated with more activity outcomes, but we need to do more research in this area, particularly about providing informal education, prompting, and not punishing children for being active. A very important area that is not well explored and but needs more work is in how to engage parents in supporting the role of the ECE setting in the development of healthy activity and regular physical activity. It needs to be meaningful engagement. I think some of the interventions have tried to have parent engagement in a passive way by sending home newsletters or sending some sort of notices home. But where the work seems to be much more effective is where they're able to actually get some responsiveness in the parents in supporting the development of this healthy activity and healthy eating. I point to a couple of examples, the work of Marion Fitzgibbons in hip-hop, and some new work that's coming out of the University of Miami shows real promise in linking parents in support of the early care setting. An area that's a gap and needs some serious consideration is the role of the health of the child care provider. Most of the early care and education staff are considered low-income wage earners. They earn about minimum wage in many states. There are a few studies of the health of the ECE staff member, but the few studies that do exist shows that their health is very poor. A lot of obesity, poor diets, inactivity, stress, sleep irregularities, smoking, and other negative health outcomes. Yet these are the same people that we're asked to be role models, to be model leaders, and to be educators with our children. And it's unclear whether their behaviors and their health status has a negative effect, or whether if there was health promotion among these, would it be helpful to the children. So I've talked about the levels of influence, but I think that we should really consider that we need multi-level approaches in order to effectively promote healthy behavior and regular physical activity in children, and that we can leverage these, we'll have more important outcomes. And the hip-hop program is a good example. It's work done over about a 10-year period that has both the educational component of healthy eating and regular physical activity, as well as a parent component. And it had a number of positive outcomes, stronger in the efficacy trial where the researchers were actually delivering, but still some important outcomes when this was translated into the effectiveness trial where it was done in a natural setting. So I think there's lessons that can be learned and taken from the work of the Hip Hop to Health Junior. So in summary, the successes that I see in the early care and education setting is our public policy efforts, the organizational interventions to try to change nutrition and physical activity environments, the conduct of regular organized lessons for physical activity by trained and skilled facilitators, It's promising in the area of the use of these nutrition and curricular and physical activity curricula, and certainly training and technical assistance is known to be effective. The research gaps, we know very little about family child care homes and how to promote healthy eating and regular activity in these settings. Similarly to what you heard in the other panel members, there's very little work going on in the infant and toddler program, although there are a few trials that are in progress right now. We need to explore this vigorous physical activity to see if that emphasis needs to be reintroduced to the ECE setting. We know that limitation in space is a problem, particularly in urban settings, and that a lot of ECE facilities don't have indoor settings, so if the weather is inclement, there aren't as many opportunities for activity. Research gap is in the role of the teachers in developing these healthy feeding and activity practices, and the staff of their own health and how it may impact the children's activity and eating practices. And finally, engaging parents and how they might be leveraged in to support the ECE program. And finally, our opportunities is partnering between the ECE professionals on the one hand and the public health community on the other hand. We've had some movements in this direction, but we need more of it. Just as Dr. Tavares was talking, we need to talk about obesity prevention and child development as one thing. We need to create and distribute training opportunities. There's not enough training opportunities for ECE teachers. We need to develop partnerships with parents, and then we need to finally have comprehensive wellness programs for the children, for the ECE staff, as well as for the families. Thank you.